Today I wish to talk about what is really current. And this is the corrosive scams that are appearing in the Ministry of Health. I want to lend my voice to this matter that is of serious concern to the Kenyan people, and it requires serious action. Ladies and gentlemen, President Uhuru Kenyatta has outlined and repeatedly emphasized the Big Four agenda. He has beseeched us to stop politicking and instead support his agenda. The most critical in the Big Four agenda is universal health care. That theft of public and donor resources is recently concentrated in the health sector, particularly theft of COVID-19 funds, is an unacceptable odour suffocating this country. It is not only a recipe for failure of the Big Four agenda, but will also certainly deny the president a coveted legacy. Consequently, I condemn this blatant theft of emergency resources and urge urgent arrests of culprits involved. However, and please I emphasize this, however, it is not lost to me that investigative agencies are seemingly overstretched by sprouting tentacles of corruption. Massive similar rip-offs involving billions of taxpayers' money in other sectors remain painstakingly unresolved. Public participation in all our affairs as a nation is a running principle set out in the Constitution. Unfortunately, traditional action by our investigative agencies do not attract public participation. Therefore, the nature of overzealous embezzlement inflicted on the health sector over time, especially the KEMSA heist now, demands that everything be done above board in the glare of the citizens and with robust public participation. Overall, the results of such inquiry must prescribe a definite, precise, and binding action against those found culpable. Only then shall the country come to terms with the goings-on in the Ministry of Health, or what, by Cabinet Secretaries Mutahi Kagwe's own admission, who the untouchable cartels in there are. For this reason, the only appropriate mechanism via which to get to the bottom of what is ailing the health sector is for the President to appoint a judicial commission of inquiry. I am by no way infatuated with proposing judicial commissions of inquiry whenever things get skewed. But here, things have indeed gone awry, and only such inquiry will soften the hearts of our development partners who threaten to abandon us at our hour of most need because of our insatiable dishonesty. If donors pull out, not only do we lose COVID-19 support, but we will also forgo over 400 billion for HIV and AIDS, malaria and TB, among other life-saving interventions beneficial to the people. So let me emphasize this. Why, therefore, do I propose a judicial commission of inquiry and not the normal investigations soiled by multiple actors? And this is a very critical component of my statement. Why a judicial commission of inquiry? First, commissioners of a judicial commission of inquiry enjoy immunity. Unlike our CID or DCI, police, or EACC, who are vulnerable to influence, threats, and blackmail by the infamous powerful cartels. So point number one, the Judicial Commission of Inquiry will enjoy immunity. Secondly, a Judicial Commission of Inquiry is public, conducted in an open and transparent manner. There is naming, shaming, and refutation. This facilitates public participation as required under the Constitution. Third, and this is again very, very important, decisions made by the Commission are binding in law. So they are not ordinary statements. They are binding in law. And just as those of a court are enforceable on their own without need for further machinations, so the end game is neat and clear for the public. Fourth, since only the President, nobody else, only the President has power under the Commission of Inquiry Act to form such a commission, this will help the President to stamp executive authority on the fight against corruption or graft with finality, and underline this, and then deflate the lingering insinuations that he is a reluctant fighter of corruption. COVID-19 pandemic has been with us for 5 months and still counting. This pandemic has ravaged and devastated our lives, torn our families apart, and pounded our economy with unrelenting cruelty. Kenyans are dying, others holding to dear lives in ICUs, HDUs, self-isolation facilities, and in their homes. Our medical personnel, true heroes and frontline soldiers, have not been spared. The disease is amok in communities, but we are unable to expansively test and contact trace. Health facilities will soon be overrun. In some, we are on our knees, terrified by the horror inflicted on us by this invisible enemy. My appeal now is directly to the President. The situation, Mr. President, is dire. In the midst of this terror, some have found in our tribulations a source of profiteering through theft, fraudulent procurement schemes, and grossly inflated prices. They need to be stopped. Chapter 6 of the Constitution of Kenya on leadership and integrity. Chapter 12 on principles and guidelines of public finance. The Public Procurement and Disposal Act and the Public Finance Management Act have failed to tame and stop them. The public is restless and now requires answers. Mr. President, a judicial commission of inquiry will unearth the real underlying problems of this malaise. Meanwhile, I urge Kenyans not to give up the fight against COVID-19. Continue observing guidelines as issued from time to time. Coronavirus is real. It is here with us. But all will be well if we protect ourselves. God bless Kenya. God bless our people.